Welcome to today's healthcare reform presentation. We will be discussing the summary of benefits and coverage requirement. My name is Erica Storm, and I am an attorney with extensive experience in employee benefits and employment law. I also specialize in healthcare reform compliance for employers and health plans. The 2010 healthcare reform law, known as the Affordable Care Act, added a new disclosure requirement for health plans and health insurance issuers. The new disclosure is known as the Summary of Benefits and Coverage, or SBC. The SBC is intended to be a short, concise explanation of the benefits available under a particular plan. Both grandfathered and non-grandfathered plans will be required to provide the SBC. The purpose of the SBC is to provide simple, consistent plan information to health plan consumers, including group health plan sponsors and individual enrollees. It is intended to help these consumers better understand the coverage they have and to help them make easy comparisons of different coverage options when they are shopping for new coverage. The SBC requirement applies to both health insurance issuers and group health plans that are either self-funded or fully insured. Health insurance issuers must provide the SBC to health plans. Group health plans and health insurance issuers are both required to provide the SBC to participants and beneficiaries. However, if the issuer provides the SBC to the participants and beneficiaries, the group health plan is not required to do so. Some plans are entirely exempt from the requirement to provide an SBC. These include what are known as accepted benefits under HIPAA, such as accident or disability income, liability insurance, and workers' compensation, along with separate dental and vision policies and limited-purpose flexible spending accounts. An SBC does not have to be provided for a health savings account, but it is required for the associated high-deductible health plan. Information for health reimbursement arrangements, or HRAs, and health FSAs that are not accepted benefits can be included in the SBC for the related health plan. The Departments of Health and Human Services, Labor, and Treasury have issued final regulations related to the SBC. In addition to the final rules, the departments released a sample SBC template, instructions for completing it, and sample language to be used in portions of the SBC. They also issued a uniform glossary to use for explaining definitions of common health coverage and medical terms. Issuers must be ready to provide the SBC to health plans by September 23, 2012. The date for providing the SBC to enrollees will depend on the type of enrollment. If enrollment or re-enrollment is during an open enrollment period, the SBC must be provided as soon as the first day of the first open enrollment period that begins on or after September 23rd of 2012. For participants who enroll another way, such as newly eligible individuals or special enrollees, the SBC must be provided beginning with the first day of the first plan year that begins on or after September 23rd, 2012. There are specific situations that impose their own deadlines. Issuers must give the SBC to health plans within 7 days of an application for coverage. If there are any changes to the SBC information by the time coverage begins, a new SBC must be provided. Health plans must also be given the SBC when the policy is renewed or reissued, or within 7 days of a request. Similarly, enrollees must be given the SBC as part of any written enrollment materials they receive in connection with the plan. If the plan does not have written enrollment materials, the enrollees must be given the SBC by the first date they are eligible. Again, if there are changes by the time coverage begins, a new SBC must be provided. Special enrollees must be given the SBC within 90 days, which is also the deadline for providing the Summary Plan Description, or SPD. If renewal or re-enrollment in the plan is required, an SBC must be provided at that time, and enrollees must also be given an SBC within 7 days of their request. There are special rules related to the SBC designed to eliminate duplication. As we discussed, if the issuer provides the SBC to enrollees, the group health plan's obligation is considered to be met. Also, a single SBC may be provided per family, unless the plan or issuer knows that any family members enrolled have a different address. Finally, to eliminate some of the administrative burden for both plans and issuers, the rules require a new SBC to be provided at renewal only for the benefit package in which the individual is enrolled, even if there are multiple benefit packages available. However, the SBCs for other benefits packages should be provided upon request. The healthcare reform law contains strict standards for the appearance of the SBC. The SBC is limited to 4 pages, although the final rules interpret that limit as 4 double-sided pages. The font size must be at least 12 point, and the SBC can be provided in either color or black and white. The departments have issued a model template for providing the SBC, and they emphasize that the full template must be used. This is an example of the first page of the SBC template. The SBC must be written in a way that the average enrollee can understand, using easily understandable language and terminology. It must also be presented in what is known as a culturally and linguistically appropriate manner. This means that interpretive services and written translations may be required. The threshold is when 10% or more of the population in the individual's county are literate in only the same non-English language. The Department of Health and Human Services intends to issue written translations of the SBC template, sample language, and uniform glossary in Spanish, Tagalog, Chinese, and Navajo. There are also very specific rules for the content that must be included in the SBC. It must include uniform definitions of standard terms, although this requirement can be met by providing a link to the uniform glossary that we saw earlier. The SBC must also describe the plan's coverage. Information required includes exceptions and limitations on the coverage, any cost-sharing provisions that apply, like deductibles, coinsurance, and copayments, and renewability or continuation rights. The SBC must also include coverage examples so that health plan consumers can identify the costs of certain types of health issues. The specific examples to be included are having a baby and managing type 2 diabetes, a chronic condition. Beginning in 2014, the SBC will also have to indicate whether the plan provides minimum essential coverage. There are certain required statements that must be included in the SBC. It must state that the SBC is a summary of the plan or policy only, and that the coverage document itself should be reviewed for specific information. The SBC must include contact information, including a phone number and web address, for obtaining the coverage document. If the plan or issuer has one or more provider networks or uses a prescription drug formulary, the SBC must include an internet address or contact information for obtaining a list of network providers or information about the prescription drug coverage. It must also include an internet address for obtaining the uniform glossary of medical terms, a phone number to call to get a paper copy of the uniform glossary, and a disclosure that paper copies are available. The SBC can be provided as either a standalone document or with other summary materials, such as a summary plan description. If it is provided with other materials, it must be intact and prominently displayed at the beginning of those materials. The materials must also be provided by the SBC deadlines and cannot be delayed to later deadlines for the other materials. The SBC can be provided in paper or electronic form, but the final rules place restrictions on electronic delivery. You may be familiar with the healthcare reform rule that says plans must provide 60 days advance notice of plan changes. This 60-day rule is related to the SBC. Plans and issuers must provide notice of any material modification of the SBC information if it is not made in connection with a renewal. The notice can be given using a summary of material modifications, or SMM, that describes the specific changes, or through an updated SBC. The update must be given at least 60 days before the change is effective. There are potential penalties for failing to provide an SBC. If a plan or issuer willfully fails to provide the SBC, it can be subject to a $1,000 fine for each failure. It could also be subject to a $100 per day per individual excise tax. Those amounts can add up quickly, so plans and issuers should take care with compliance. To sum up our presentation today, health plans and issuers are responsible for providing an SBC at various times beginning after September 23, 2012. The SBC must be a concise explanation of benefits, limited to 4 double-sided pages. Fortunately, there is a template available to use in preparing the SBC, along with instructions and supporting documents. The SBC may be provided in paper or electronic form, and can be included with other summary materials, like the plan's SPD. The SBC must be updated 60 days in advance of material modifications not made in connection with renewal. Don't forget, costly penalties may apply for noncompliance. Your broker has a full suite of documents to help you with SBC compliance. Please contact your broker for assistance with all of your healthcare reform compliance needs. Thank you for viewing the Summary of Benefits and Coverage presentation.